Just this past week, we marked 100 days since the start of the devastating Los Angeles wildfires. And even though cleanup is well underway, our lungs will take a very long time to clean and recover.
Yeah, it's a harsh reminder of how vulnerable we are to the air that we breathe every single day. To tell us more about what they are seeing in their patients and what we can do to help keep ourselves healthy, we have with us today pulmonologist Dr. Shyman from Dignity Health, St. Mary Medical Center, and then Dr. Dalia Artal, Medical Director of Chest Imaging at RadNet. Thank you for both of you for being here. This is such an important thing, and I think it's something that we've kind of forgotten a little bit about, right? Because particles can still be in the air. We'll start with you, Dr. Rao. What are some of the things that you're seeing in your patients, and how realistic can we be? Basically, you know, we can't really choose what air we're breathing, right?
Exactly. Well, thank you for having us on today. We appreciate it. You know, definitely during the wildfires and obviously during the Santa Ana winds, we do see an increase in dust and dirt in the atmosphere. And especially for patients who have the chronic, respiratory conditions like COPD and asthma, we see a rise in their symptoms, increase in shortness of breath, wheezing, cough, and we definitely did see an increased number of visits to the emergency room as well as to the clinic. The best way, and really the only way we can try to prevent the inhalation of these particulate matter or dirt or dust is really just through masking, and either just try to find an N95, especially if you're going to be exposed to it for an extended period of time.
All right, what can you tell us about low-dose CT scans for lung cancer screening, and who needs to get those?
So low-dose CT scans are one of the best screening tools we have for early detection of lung cancer, especially for patients between ages 50 to 80, patients who are actively smoking, patients who have an extended duration of tobacco use, maybe over 30 years, and those who have quit within the past 15 years. Early detection will lead to early survival rates for lung cancer.
And let's talk about that, the low dose, Dr. Ardell, how it works. Are they safe? A study just recently came out that possibly they can cause cancer.
Those are very great points. Yes, a low dose chest CT is a special chest CT that is especially low dose. It takes hundreds to thousands of individual X-ray images and reconstructs it, giving you a 3D image of your lung. So we can detect very small nodules, and we use the very smallest amount of radiation as possible to detect those nodules. In fact, it's about 5 to 7 times less than a routine chest CT, and you can think about it as how much radiation, background radiation, you would get if you were to fly from LA to New York. So it's a very small dose, and it's, again, painless, quick, easy, and screening is the key. Screening saves lives.
What are other benefits of lung cancer screening, would you say?
Well, clearly, it's early detection. If first of all, lung cancer is the #1 cancer killer. It's greater than all of breast, prostate, and colon cancer combined. And the key is early detection, because most of the time, lung cancer is not detected until patients are symptomatic, and by then, it's not as treatable or in a possible curable state. So screening is really early detection and finding those lung nodules and acting on them with your doctor to make sure that you get treatment if needed early on.
And what happens if a nodule is found?
Well, the first thing to do is definitely do not panic, because most nodules are benign. They're usually from a prior infection or inflammation, and they're quite common. So definitely do not panic. You need to follow up with your doctor. Sometimes they might recommend a shorter imaging follow-up test, or sometimes there might be some more additional testing that is done. But the key is that not to panic again, and lung nodules are quite common.
Dr. Rao, if somebody's a smoker, will a screening CT help, and even if they want to keep smoking?
Yes, I mean, the first thing is obviously to quit smoking, and that's something we reinforce on every visit when I see patients in clinic who are smoking. But really, as Dr. Artal mentioned, it's the early detection. And if we see a lung nodule and it looks suspicious, we'll do a biopsy, and early detection saves lives, and that's really the key here.
That's what I keep hearing is Early detection saves lives. Both of you have said that. Thank you so much for being here and clarifying some things for us.
Thank you.
We appreciate it.
All right, let's check in with Gene. Looks a little hazy out there today, Bal.